Ever since we've been able, humanity has been searching for a cure for cancer. Because of this, many are taking extra precautions to steer clear of this deadly disease, especially women. We may not have found a cure yet, but there's at least great news to celebrate, since scientists say that hormone replacement therapy does not increase cancer risk. If you want to know more about this topic, then make sure you tune in until the end. In recent news, hormone replacement treatment does not raise the chance of developing cancer, according to researchers. The relationship between HRT and breast cancer risk may be more complex than previously thought, according to more recent research that has followed women over a longer period. Using HRT is still a contentious issue. According to medical standards, HRT may be beneficial for some women, particularly those who experience early menopause, as it can improve their quality of life and safeguard bone health. To determine if HRT is good for you, it is best to educate yourself and consult with your doctor because the dangers and benefits vary for each woman. Hormone replacement therapy, HRT, did not raise the risk of breast cancer recurrence or mortality in women having a history of the disease. The results of this most recent, modest study contribute to the expanding corpus of an investigation into how HRT affects cancer risk. Menopause symptoms, including vaginal dryness, hot flashes, disturbed sleep, and others, are brought on by a decline in estrogen levels. One of the best ways to treat these symptoms is using HRT. Systemic estrogen therapy or vaginal estrogen therapy both involve increasing estrogen levels either throughout the body or close to the vagina. HRT's safety, however, has been highly contested. According to Debasish Tripathy of the University of Texas MD Anderson Cancer Center in Houston, the majority of breast cancers depend on the hormone estrogen to thrive. As a result, several breast cancer treatments function by lowering or stopping estrogen production, which might cause symptoms resembling menopause. Therefore, it is a concern that raising estrogen levels to reduce menopause symptoms may raise the risk of breast cancer, particularly in those with a personal or familial history of the disease. HRT has been linked in numerous studies to an elevated risk of breast cancer. Thoughts about safety were allayed last year by a 300,000-woman investigation, which revealed that using HRT to treat menopause symptoms does not increase the risk of premature death. Aside from that, HRT may raise the chance of breast cancer recurrence in those who have already had the disease, according to prior studies. Sven Kold from Odense University Hospital in Denmark and his colleagues gathered data on 8,461 postmenopausal women in Denmark who had been diagnosed with early-stage breast cancer between 1997 and 2004 and had treatment to further study the likelihood of recurrence. Of them, 133 received systemic hormone therapy alone or in conjunction with vaginal estrogen therapy, and 1,957 just used vaginal estrogen therapy. No one had ever used HRT before cancer therapy. Now, researchers put these two studies side by side, and they've noticed a stark difference. In comparison to 19.2% of those not receiving either treatment, 15.4% of those receiving vaginal estrogen therapy, and 17.1% of those receiving systemic hormone therapy experienced a cancer recurrence after 10 years. There was no link between using HRT and passing away. As opposed to women who did not take hormone therapy, those who combined vaginal estrogen therapy with a class of medications known as aromatase inhibitors, which block the production of estrogen, had a 39% higher chance of recurrence. However, their chance of dying too soon was not increased. Tamoxifen, which specifically blocks estrogen in breast cells, did not raise the risk of recurrence in women who also received vaginal estrogen therapy. Tripathy, who wasn't part of this research, thinks that by replacing estrogen, they are directly opposing how aromatase inhibitors function, which is why they're finding negative results with them. Because the study population was fairly small, particularly for individuals on systemic hormone therapy, Tripathy states he doesn't think these results are conclusive enough to inform someone that they can use these estrogen products safely. However, he advises tamoxifen rather than an aromatase inhibitor if you absolutely have to undergo estrogen replacement therapy for those who have had breast cancer. Before this report came to light, several studies were insinuating that hormone replacement therapy can increase the risk of breast, ovarian, and womb cancer. We're not entirely dismissing this thought, so let's take a look at where this idea is coming from. Cancer Research UK published an article on whether or not HRT increases an individual's chance of getting cancer. If you're curious to know more, then you should keep on watching. HRT is a medication that alters hormone levels in the body to lessen menopause symptoms. A chemical messenger is a hormone. They may have an impact on our mood, fertility, and growth. The ovaries begin to generate less less of the hormone estrogen during menopause. As a result, some people could suffer menopausal symptoms like mood swings and hot flashes. These symptoms can be extremely bothersome for some people, and HRT can help to lessen them. Hormone therapy is an option for transgender men and women. However, the amount of research on the potential cancer risk is still insufficient. Only menopausal HRT and cancer risk are discussed in this portion. Let's now discuss the two primary forms of hormone replacement therapy: estrogen-only HRT and combination HRT, which uses both estrogen and progestogen. Other types of HRT, such as tibolone, are less frequently recommended. If you think HRT would be beneficial for you, your doctor can provide you with more information on the various forms. Now, you may be wondering, should I take HRT? HRT risk is dependent on a variety of factors: the kind of HRT used, when they begin using it, how long they use it, their age, and overall health are all taken into consideration. The advantages of using HRT will also differ from person to person. Because every person is unique, discuss your options with your doctor. It's crucial to keep in mind that factors other than HRT have a greater impact on cancer risk. For instance, giving up smoking, maintaining a healthy weight, and consuming less alcohol can all lower your risk of developing cancer. Now for the most dreaded question: does HRT increase the risk of acquiring breast cancer? Before it was known that using HRT increased the risk of developing breast cancer, many women used it for years to treat menopausal symptoms and stop bone loss. When research in 2002 established a relationship between HRT and an increased risk of breast cancer, the number of women using HRT sharply decreased. Breast cancer risk is elevated by the majority of HRT forms. However, those who use combination HRT, which contains both estrogen and progestogen, are at a higher risk. Tibolone has been related to a higher risk of breast cancer than vaginal estrogens. Breast cancer risk is only modestly elevated when HRT is used for less than a year. However, the hazards become more severe and last longer the longer you use HRT. HRT-related breast cancer risk varies from individual to individual. The risk may vary depending on your age when you start HRT, other medications you may be on, and overall health. Before or soon after menopause, those who start HRT may experience a bigger risk than those who start HRT at a later date. But what about ovarian cancer? Will my chances of getting this increase? Yes, ovarian cancer risk is somewhat raised by both estrogen-only and combination HRT. However, if HRT is withdrawn, the risk gradually returns to what it would have been in the absence of HRT. Tibolone and ovarian cancer may or may not be related, according to current research. How about endometrial cancer? Does HRT increase my risk of getting this then? The type of HRT affects the risk of womb cancer. Womb cancer risk is increased by HRT that only contains estrogen. The risk increases with the duration of usage of this form of HRT. As a result, estrogen-only HRT is typically only provided to people who have undergone a hysterectomy, as they already have no risk of developing womb cancer. Combining HRT can lower the risk of womb cancer. However, the greatest increase in breast cancer risk results from combination therapy. Therefore, it's crucial to discuss the balance of potential benefits and hazards with your doctor. Tibolone also raises the risk of womb cancer, much like estrogen-only HRT does. In another article published by newscientist.com, they claim that HRT doesn't increase the chance of dying early as well. A 300,000-person study demonstrates that HRT treating menopause symptoms does not increase the risk of early mortality, dispelling long-held concerns about its safety. Reassurance that using hormone replacement treatment to improve menopausal symptoms doesn't increase the risk of dying young and may even be marginally protective comes from a sizable UK study. Every woman will eventually reach menopause, and menopausal side effects can have a variety of implications on women's life. Therefore, it is up to individuals to balance the benefits and hazards of utilizing HRT. In the end, the best advice we can provide you if you're thinking about utilizing HRT is to discuss all of your options with your doctor. Inquire about ways to manage your symptoms while reducing your chance of breast cancer. And with that, we're wrapping up today's video about what scientists have to say about HRT not increasing cancer risk. Hopefully, this video enlightened you about the topic, and it's best to consult with your doctor first and foremost. Before you go, don't forget to leave a like and subscribe to our channel with the notification bell on for more videos like these. And we'll see you again next time. Thanks for watching.